Well, May is Mental Health Awareness Month, and every year we like to come out here to Gulfport Behavioral Health, find out what some of the great programs and some of the great people that are involved with helping other people. We're talking to Danae Smith, who's the Director of Admissions. How are you?
Good, how are you?
I'm very well, thank you. So tell us your role here as being a Director of Admissions whenever people come in to find out if they need some help.
Okay, so I oversee all of the admissions department. That's a 24-hour department. We offer assessments on weekends, holidays, 24 hours a day. We take walk-ins. Referrals are not necessary, and you can always call the 800-831-1700 number to inquire about any assessments. You're going to be assessed by a master's level clinician with a master's level in a mental health profession. And then from there, they will recommend level of care, whether that's inpatient or outpatient treatment. And from there, they either go inpatient or the referral is to outpatient.
Can they do this virtually?
Yes, they can. We offer virtual and telephone assessments, again, 24 hours a day, 7 days a week.
Wow. Most people it's like an 8 to 5 thing or whatever, but it's just medical offices. But the fact that, and I guess for that, mental health never takes a break.
Never, never.
So,
we want to be as accessible as we can, to serve our community and our patients.
So whenever you bring the people in here, that's when you find out exactly, excuse me, what level of care they need.
Yes, yes, after they are assessed.
There's so many wonderful people that are involved with helping others here at Gulfport Behavioral Health. One of them is Mary Evans, who's Psych Tech. How are you?
I'm well, how are you?
I'm very well. Tell us a little bit about yourself, if you would, please.
Here on the Gulf Coast for the past, 30 years, and educated with mental health and pharmacy and things like that.
And then you decided to come to work here at Gulfport Behavioral.
I did.
But how long have you been here, Mary?
A year and 1 month.
Okay, all right. Well, tell us your role here.
I'm a psych tech. I worked on children and adolescents and adults.
Okay. And Psych Tech meaning figure out what kind of help they need?
Yeah, children with dignity and respect, compassion, things like that.
That's a lot of people don't have a hard time dealing with people with mental issues. And you, I guess, set them down and show them there's help for you.
Yeah, there is. If you treat them with compassion and dignity, they want to have the acknowledgement of the respect of others. So they want to feel trusted in you.
That's the biggest thing.
Big thing.
Big thing.
Protection.
Anything else?
No.
Pretty much it?
Yeah.
You're happy to help them?
Very much so. Very much so.
One of the backbones of a great company like this at Gulfport Behavioral Health are their nurses, because all the help that they get. Well, Susan Baudouin is the Director of Nurses here at Gulfport Behavioral Health. How are you? Nice to meet you.
I'm doing well. How are you, Jim?
I'm very good, thank you. Tell us a little bit about yourself first, and then what brought you here to Gulfport Behavioral Health.
Okay, I've been a nurse for about 10 years. I've been here at Gulfport Behavioral Health for the past 4 months as the Director of Nursing, and previously have been here since 2019.
What made you want to be involved? I mean, there's so many different fields of nursing that you could do. Why mental health?
Mental health has always been a very much compassion of mine. And here on the Gulf Coast, we have very limited resources. So being a part of a company and a facility that reaches out to our community and gives them the help that they need is something that is very valuable to me to help these people.
And I mean, not only to help them, but encourage them.
Absolutely.
I mean, that is a big thing.
Yes, we see patients come in on their worst day. And to see them walk out of this building with smiles on their face and going back into the community, ready to face their day again, it's beautiful. It absolutely is.
I see a thing that pops up online from time to time, some quotes and different things about when you ask him if he's all right, how he's doing, he just says, "I'm all right." He's not. There's so many different things that are involved, and you could see a person on the street that, they may seem fine, but inside there's so many struggles that they're dealing with, and that's why you have some great people here to work with them.
Absolutely. We have an amazing staff from the moment anyone walks through our doors to the moment that they leave. We are focused on patient safety, and the compassion and the empathy that we all, have inside of us is a wonderful, wonderful thing to see. And I'm very, very proud of my staff.
I'm sure of that.
Yes.
Susan Baudouin, thank you so very much.
Thank you very much.
Now, of course, they have a lot of great programs here at Gulfport Behavioral Health, inpatient and outpatient. But we're going to talk with Desiree Bridges, who is the outpatient program manager. How are you, Desiree?
Good.
Tell us about yourself, if you would first, and what got you here.
I'm originally from Slidell, Louisiana, and so I moved to Gulfport, Mississippi, and so that what brought me here.
Mm-hmm. And why behavioral health?
Well, I have family that have behavior health issues. So I have I have an aunt that has diagnosis of schizophrenia, and I have a cousin that has bipolar, so that has been an interest personally for me.
As an outpatient program manager, what does that include?
It includes therapy with adults and adolescents, Monday through Friday. For the adolescents, it's in the evening, so it works out with their school schedule. And for the adults, we do it in the morning from 9 to 12.
Talk about some of the different ways that you have these therapies.
So with the adults, we talk about different topics to help them. They may be dealing with some coping skills that are negative for them, so we help them to learn some healthy coping skills, depression, anger, anxiety. And with the kids, the same thing. A lot of them have anger issues and behavior issues that they need to work on. So we help them with that with the group therapy and some individual therapy as needed also.
What about the different activities that you have? I mean, you do yoga?
Absolutely. So we do.
Oh, she perked up on that one.
Yeah, we do. It's very, very beneficial to the clients here, that relaxation that we offer, whether it's meditation, creative expression, some leisure education for them.
And the pet therapy.
Absolutely.
Talk about the pet therapy.
So that is awesome. A lot of patients benefit from that pet therapy. It really, really helps them what they may be going on. I think the pets are really beneficial to the program here, and for the patients' benefit to help them with some coping skills.
Well, being single myself, I have my babies at home that they are definitely great for my brain and and everything. So
it's a calming.
It really is, and it really helps the people get through what they're doing. Thank you so much for your help there.
Thank you.
If you'd like some more information, if you have yourself or a loved one that needs some outpatient help, you can call the number on your screen, set up an appointment. You can even do it online if you'd like to, and get an evaluation to find out what kind of help that they can bring you here at Gulfport Behavioral Health. They're located on Highway 49, just north of I-10, by the post office.